We're live.
All right, today is Monday, December 16th. This is a Student Services Committee meeting held in the School District of Menominee Falls District Office located at the Village Hall Upper Level Conference Room 3344, 3345, Pilgrim Road, Menominee Falls. The possibility that a quorum of the full membership of the Board of Education may be in attendance at board committee meetings. There will be no full board action taken at any committee meeting. Only members of the committee may vote on any item on the agenda. A live broadcast will be streamed on the school district's YouTube page. To watch the recorded meeting, please visit our School District of Menominee Falls YouTube site. We are called to order at 6:31 p.m. and has the meeting been properly posted?
Yes, it is.
All right. I need a motion to approve the minutes.
Motion.
I'll second. All those in favor? Aye. Motion has passed. All right. Board Member Langer is excused for the evening. Moving on to discussion items. So we have nursing services updates. Thanks for coming in. And we'll get started.
So tonight, I have Alyssa and Pam, our two district nurses, and they're going to be providing an update. And like we talked about, I think it was at our last meeting, our committee meeting, we started to build a regular schedule. So this is one we're looking at having to be as an annual meeting for the updates that are going to be coming from them. So they've done a lot of work, they put a lot of information together for you, so they'll be doing that. I'll be clicking for you.
Okay,
So
nice,
just
perfect.
let me know when.
We'll just kind of take turns one slide.
Yeah, sure.
All right, now I'll hand it over to you.
You can click.
Go ahead.
Okay, my name's Alyssa. I cover Ben Franklin, Shady Lake, and Valley View. And
I'm Pam and I cover Riverside North in the high school.
then up there is just the name of all of our health room assistants that we currently work with. We had 2 new ones this year. So that was a big change in the beginning of the school year, getting them all situated and acclimated. So that took a lot of our time in the beginning of the year.
Yeah, and we have one more that's actually leaving after Christmas break, so.
So a little more moving around.
Yes, yeah.
Moving all over.
So some of the benefits of having a school nurse is that staff training in the beginning of the school year. We go over all the emergency medical stuff for teachers and staff members, for field trips of the students that we have if they have to take emergency meds with them. That encompasses EpiPens, Alvoq, Narcan, diazepam, inhalers, other rescue medication like glucagon for our diabetics. So we go over that every single August. And then we also do daily administration of medications and as needed ones for students in every school, every grade level. We also do individual care plans that we oversee in coordination with parents and the specific child's healthcare practitioner. We also oversee some 504s, so we're case managers for 9 students in the district. And we also attend and participate in annual IEPs when we are needed. We also do a lot of work in the beginning of the year, especially September, October, with immunization compliance for the district, since it is a Wisconsin state law. We have to report on the 40th school day to Waukesha County our immunization compliance for each school, and it encompasses the whole district. So you'll see in the next couple slides about what that was. And last year, our compliance rate was over 99%.
And it has been as a whole, generally speaking, until this year, and I'll
Yes.
explain why.
Sure.
We get to go ahead and switch the slide. Okay, that's kind of what you just
Yes.
talked about.
Pretty much, and then we just do coordination of student and managing systems. We always document when a student comes in, what time we give medications, daily stuff like that. If we talk to administrators, teachers, parents, that's all recorded on the computer. We provide health education for students, families, and staff to decrease disease transmission, especially during this winter cold and flu season. We provide communicable disease and promote compliance with the word, like I said before. Implementation of healthcare plans, so we see a lot of them. Asthma, diabetes, seizure, food allergy, bee and wasp allergy, and then general healthcare plans for those that don't fit in those brackets. We also do a lot of vision screening with every fall with the Menominee Falls High School, Healthcare
Yeah,
Academy.
Healthcare Academy students, high school
That they help us
students,
do those for 4K and 5K, and then as needed hearing screening for IEP and special ed referrals as needed. Daily meds, all the grades, and training health room assistants on proper medication administration as well as a big thing.
But probably one of the biggest things that we do really is training. We do so much training and teaching. From the beginning of the year when we're training all staff on emergency medications, and it is mandatory that all staff attend this, so we will do it in every building. So
Yep.
Alyssa will do her 3 buildings, I'll do my 3 buildings, and each year we kind of tend to expand on that training. So we've gone into now talking about kind of emergency response to things, what to do in an emergency, where all the AEDs are located. And we'll touch on that a little more when we talk about our Project Adam designation.
Really quickly, I think it was on the prior slide, you don't
Yeah.
have to flip, was you mentioned field trips. Obviously, you have day trips, which are a little easier to coordinate, but both of my children have gone through North, so they've done the
That's a trick that I always
thing.
coordinate, yeah.
And then I figure like there's probably some groups and clubs that do like our
High
activities,
school
like
does a lot, and FBLA,
yeah, FBLA,
Does
and I was thinking
weekend
like even like
ones.
the cheerleading or the dance teams that goes to the nationals, I know
So,
our
yeah.
men's basketball is going. So when there's traveling students, you're not going with them on
No,
all
we
those
don't
trips,
go,
right?
and actually, so the only time we go, so I've had to go like on the DC trip, when we have a student with, I've gone with a diabetic student.
Okay.
This next year I'll have to go, I think, with a special needs student if that student goes.
Okay.
So the parents can opt to go, but they'd have to pay for the full price of that trip as well.
Okay.
So we try to make it so, and the student usually wants to be without the parent, but the parent's not there. So then in this other situation, when I went, we had adjoining rooms and I was able to access the student even into the night for different medical needs, but
Okay.
otherwise, no, we don't go. But we
But you're
coordinate the
coaching
whole
up in the whole
trip.
training
So we
aspect of
have to go through the whole, what I've started doing, because this is mostly the high school, middle school level, so I've
Yep.
started going to the meetings.
Okay.
So when they have a parent meeting about a trip, I've started going and then I will talk to the parents and say, these are the forms you're gonna need, your student may not carry any medications, and we just go through all of the things. Healthcare plans, all the things that they need to know and have an opportunity to answer all the questions, take home all the forms. And then I will coordinate all of it into the chaperone folders. And then when it's the DC trip, then I have several meetings, cause I have meetings with chaperones to train on certain kids that have certain medical needs.
Sure.
So every year it's determined, we get a list of the kids, especially for DC, cause it's a lot of kids. And then I go through the list and then we determine if I need to go or not in that year.
Okay. And then also real quick, with your health room assistants, what is their role? How do they support you?
So we have 6 health room assistants that are full-time, that are in each of our buildings, that they work specifically in the health room, and then we just float around and support as needed. We fill in for when they, like today I was at Valley View all day, and one of my assistants there had a personal day, so I stay there for that. But they're mostly doing a lot of the day-to-day care, and then we supplement with other stuff.
So
and
there's
special-
things that we may get called, so we're always on call if we're not at that building, so I think we each try to keep a schedule. So that building knows, okay, Pam's gonna be here from 7 to 10. And so often they'll be waiting for me with questions or issues or different things. And while we're there, students will come in and one of the things we can't delegate to those staff members is like assessment. There are certain assessments that we just have to be there to assess situations, assess students, so we may get called over for whether it be a possible fracture or a head injury or what
Concussion
have you.
stuff.
A student having a seizure, it could be any number of things that we have to go over and delegate. So or not delegate, but that we
Assess.
take care of and assess. But we delegate to them. We can delegate, medication administration, we can delegate certain tasks like catheterizing of a student, doing a tube feeding, certain things like that. They may not do.
Basic first aid.
Yeah, basic first aid, diabetic cares, although we supervise that really very much directly. So they don't do a whole lot independently when it comes to decisions with diabetics.
Yep.
We really are very active in that. We have a lot of diabetics in our district. of all different ages.
And you'll see
Sure.
that in the coming slides.
Sure.
Yeah, so that's kind of their role.
And what are their credentials? I'm sorry, this is my first time
No, that's
getting to know everyone, so I'm like, how does this work?
She's jumping ahead, so.
It's preferred that they are CNA or a certified nursing assistant.
Yep.
Or a medical
Some
assistant
medical.
or some sort of medical background, or if they are not those things, that they have the basic CPR, AED, and first aid training.
Yep.
So they have to have those things and then maintain currency with those.
Right, okay.
And we have had people that come in that got the training but have no experience with health room.
Sure, okay. Thank you, that's helpful. Okay,
You think you covered that one?
Yeah, I think
I
we
think
kind of
so.
covered this, yeah, the procedures that we do.
That's a big,
So then we just went over all of our healthcare plans by each school, so
Melissa,
as
do
you
you
can.
wanna explain briefly what a healthcare
Oh,
plan is,
yeah.
too, they might not know
Sorry,
what that
I
is, yeah.
generalize sometimes. Healthcare plans are specific plans, like as you see, I'll just go over asthma for one thing. So in Ben Franklin, it's a 4K through second school. So say I have a first grader that comes in and their parents are like, oh, my student has asthma. Usually we have them fill out a asthma form that goes over their triggers, emergency contacts, what medications they use to help with those asthma exacerbations if they would go into an asthma attack, what to do if that's not gonna work, who do we call next, all their allergies. So that's filled up by their doctor. It can either be a pulmonologist, an allergist, or the regular primary care physician, and then has to be signed by the doctor and ourselves to make sure everything looks right, where it's not like we're giving albuterol every 15 minutes. It's gonna be like every 2 to 4 hours or before in contact with triggers, so they're very individualized to the student.
And then it's our job to distribute these
Yep.
plans to all of the staff that deal with that student. So at an elementary school, it'd be all their
A lot.
specials teachers, their
Principal.
the primary teacher, the principal, at the high school level, it's a lot more. And this is all electronic now, we used to have physical copies that we gave all the staff, this is all electronic.
okay.
And they have to go in there and
In Power School.
acknowledge in
Oh,
Power
so
School.
that was my next question,
They have to
is
go
this all
into
in
Power
Power School?
School
Okay.
and view and acknowledge that they understand that plan and kind of check it, and then that there's a record of that, so that's the staff's.
And then they print each of them off for each student for their sub plans, so the subs know as well.
Good.
And then we have physical backups as needed
Yeah,
for,
so that's our
internet.
communication. Power School has a really nice thing now where if a student has a medical condition, let's say they have asthma, but their parents have decided they don't want a healthcare plan. We have an icon that's a medical alert symbol. And so every staff member, when they go through their student list, can see which students even have a history of medical things in general, which is really great. So.
So then we have like asthma, we have seizure ones, food allergy is a big one. We have one diabetic that I work directly with at Ben Franklin, a couple of general ones and no BE ones, which is great. So you can keep clicking.
and you'll see that food allergy one comes back.
That is gonna be
Yes.
that is a huge one.
That's the main
there.
one.
So EpiPen training is very crucial.
Yes.
Everyone needs to know how to use an EpiPen.
It's Riverside, Shady,
And all across the schools, asthma, food allergies,
Yeah.
huge.
We
And then-
heard about that a little bit when we did our food service presentation about
Yes.
food allergies too, and how much that's come up just recently.
And then the general healthcare plans could be any other variety, sickle cell disease, any other variety of
Ulcerative
diseases
colitis.
that children may have in the district, so.
For vision screening, like we do in the beginning of the year, we usually focus now on 4K and 5K. So out of the total students, we had over 500, 550 it looks like, and then the total referred means however many students each of those schools failed the initial screening, and our screening that we do is very
It's very
easy,
general,
very
it's just a very
general.
general basic, yeah.
And if they fail that, then it's recommended that they go to their pediatrician for a referral to like an ophthalmologist or optometrist to see if they would need glasses or further steps after that. So it takes at least 2 weeks.
It does,
For
so
us
2
to
weeks
do
of us
this.
full-time and working directly with the high school students who are fantastic.
Yes.
And we really love utilizing the Healthcare Academy because it's exciting to give those students that opportunity and they absolutely love doing this.
Yep. And then Pam
They
and I,
really, really love this, yeah, so it's
and then we take two days before the vision screening to
train
train them how to do the actual procedure.
So kind of picture, and this was, I'm glad you said that, because one of the things I was gonna point out is fill in how much time that actually is, because you're talking about 500 kids over a 10-day period
It's a lot of,
between two people, that's a lot of little eyes.
it's
There's-
nonstop, it is, we're exhausted.
And then for families,
It's really tiring,
Yes.
actually, you are standing and it's
Yes.
nonstop.
and these kids
Yeah.
cannot just walk back to class by themselves, so it's
They're
constantly
little,
moving back
so
and
you're
forth.
back and forth
Right.
and
All
back and
So we
forth.
get a lot of steps.
Are we required to do that screening, or is that a
No,
value-added
it's
service that
something
we
we
do?
offer.
Okay,
Yeah.
we're trying to differentiate, like, hey, what's state mandated versus the whole
No,
program
I mean,
benefits.
most
That's
children, if they're getting, going to their pediatrician as they should every year, that's being done, but a lot of children aren't going.
Yeah.
Right.
That's not being done.
good.
This way we can help with that.
And there's a lot, I mean, when you think we've caught 40 kids that would have
Yeah.
fallen through the cracks otherwise, so that's
That's
good.
incredible. Do we do hearing tests at all, or is it just focused
So
on
we
vision?
do not do that anymore, so we were, years ago, we were doing screening every year, the hearing screening, just like we did the vision
It's
screening.
terrible.
It is we do not have an environment conducive to do hearing
That's fair.
screening, it's, no
So we
matter
do-
where you go, it's a
Yeah.
noisy school.
Yep.
The kids have no idea what they're listening for, it just is not.
So we do it as needed, like if there's a
On a one-on-one
referral,
basis.
Sure.
to make sure that like, oh, my student can't hear me, is this a learning issue or is this like a actual physical impairment? So we try to do that in the beginning, to rule that out, if they would need a referral for a special ed or any more services after that.
So we still keep our equipment and we still do screenings every year, but it's
Not on the scale
it's
this
on
is.
referral, it's not on this kind of scale.
Yeah.
It doesn't work.
I love the answer, no quiet please.
Yeah.
They're just,
It needs to be dead silent and
It
it's
is.
not.
I remember I actually
Really
had that
tough.
when I was in elementary school,
Yeah.
and you listen for the beep, and then you have to raise your hand.
Oh, and if you're trying to tell a 4-year-old how to do that, they have no idea.
And then-
No idea.
They won't raise their hand at all and you'll
Or just
say,
be like this
do you
whole
hear
time."
that? Yeah, yeah.
Yeah.
Don't forget to raise that,
Right, right,
they'll do
right.
one or two and like,
And they have, no, it just
it's
doesn't
a more
work.
difficult one.
Okay, immunization. So we had some new immunization, requirements that were passed this last year. And
By the state, not by
yes,
us.
by the state, not by us. So we're told what immunizations are required. So the things that changed are, in the upper levels. So Tdap, which is an adolescent booster shot, was a 6th grade requirement, is now a 7th grade requirement. So that's not a big deal because that actually gave those kids more time to get that shot. Where we really fell off, the charts was they added a meningococcal vaccine that was often being given, but it is now required not to have just one dose, but 2 doses. So the first dose is given right around 6th, 7th grade, and then the second dose is due sometime prior to senior year in high school. So that is the new requirement. Now this past year, they told us all we had to have, we didn't have to have the first one, but all kids in high school by the time they were a senior had to have had at least one. And so the problem is this is hard to even
We
explain
did this in March.
but the software
So,
that we
right.
have on our computer changed for the new final requirements. So them giving us kind of
A leeway period.
a leeway period for another year does not show up. So it shows up as us not being compliant with all, now these still are not terrible rates, but we
No.
need to be 99% compliant as a district. If we are not, which we are not, next year we will have to exclude students, so that is the law. So now next year that turns into, if you have 20 students at North that do not have immunizations, and we have quite a process of notifying these parents. I mean, short of knocking on their door and taking their hand and going to the doctor with them, that is how many times that we say, okay, this is what you need to do, and they still don't do it. Well, now it will go over to the principals, and the principals will have to make those last calls and say either Johnny gets his vaccine or you sign the waiver today or Johnny cannot come to school.
For 10
He
school
does.
days.
So that
Not
becomes
10 days, 10 school days.
a real
Right.
problem for administrators to actually, but we are by law have to exclude now, next year.
But then after
What
the,
does that mean,
I
exclude?
mean, you cannot come to school until you either sign the waiver
Okay.
form
Right.
or you get the vaccine.
Okay, and then, are parents given this information, I'm assuming at like the sign up and
Starting,
nights
they're
too,
actually
so then-
starting, we start the information at the end of this school year for
Yes.
next year.
Proper.
It starts in this,
Sure.
spring, and then we begin as soon as school starts.
Sure,
We go through and see who needs what.
Yep.
And then 15 days later, and then another
If
15
legal
days.
notices out.
So with
And there's
the,
phone calls
yeah, with the
and-
process of them filling out the form, and I'm just tracking this in
Yeah.
my mind of how this all works so I'm assuming that you fill out the record or you fill out the waiver, it all comes in one
It
stop
does, and it
shop.
can be done electronically too.
Yes.
So
So
then,
it's really, we
It's
just
just
replacing that we're
email
not-
it to them.
Well, so here's an instance, I'm a little unique here, I
Yeah.
have one child with a birthday in July. So registering for school, everything's up to date because I would have had the birthday appointment. I have another child who has a September birthday. I would never give you the immunizations because that would be old information, I wait till that
Right.
appointment. As soon as they have their appointment in September, then I would update it to them. But I took that as like, hey, that's my duty to get that to you,
Right.
and then you guys know it coincides with the
oh,
birthday.
okay, so
But so some
I'm
people are
guessing
forgetting that either
it falls
A,
off the radar.
I
And
had
so
a
let's
birthday.
say it's okay if your student can't, let's say for whatever reason you can't get that appointment in time. That's okay.
Mhm.
What we say is just sign the waiver, so we are compliant with the
Right.
state.
As a law.
And
Yeah,
then
a lot
when
of
you get
people
the
don't know that.
vaccine,
Mhm.
and we tell them this, then just bring it in, it's okay, you don't,
Cause we can change it very
we can
Yeah.
change
Right.
that, we'll just add the vaccine. So it's really,
Okay,
it's really tough,
And do
you
you
just
have
have
a date that you have to like have your
The
compliance
40th
by?
school
yeah,
day.
the 40th school
40th
day,
school day,
and
okay.
we have deadlines that we have to get out the communication to parents.
And that's physical mail, sometimes with elementary, I send in their backpacks because it's easier for parents to check. Student backpacks, we always send a physical one in the mail, like snail mail, phone calls,
Yeah.
emails, and we attach the
That's
waiver,
fun.
processes, all that stuff every single time.
It's fun.
It is
Sure.
all consuming the first couple of months.
so then now because we were below that 99, for next year, we have to exclude. Now, if we hit that 99 again, does
Then
that
the
fall
next year,
off?
we don't
kind
have to
of-
exclude.
Yep.
Right.
Okay.
Every year we have to reach 99% compliance.
Okay,
Which is very
Sounds
difficult.
like
it's a lot.
but
Mhm.
actually, it gives us a leeway where we could have 5 or so students at each building roughly that maybe aren't compliant and we still are okay.
But you wanna be able to strive for 100%.
Right,
Of
so
course
that
we
you-
do,
right.
of course we do,
Right,
yeah, so we do
right.
strive for that, and yeah, we do work really hard at this.
Yep.
This
Has
is
the
a
change
priority.
in the registration, and how the schools aren't broken apart by each school registration, that's all
Yeah, our
centralized?
back to
I
school
think it's
fair,
wonderful.
that
we have our own
Gosh.
table there, and we have all these forms,
We love that, yeah.
available to it, we always talk to parents,
Cause then
So
I'm
it's very
assuming you're hitting
nice.
the parents and you're hitting all the kids and all the grades
We
and all
hit
the
all of
schools at
them,
one
and it's
point,
really
so
great, yeah,
That's
we
awesome.
actually
we're just
really love
coordinating
this.
3 different nights with 3 different schools for both of us, which
There you
is a
go.
lot.
And
So
that's
much better
good,
for us too, thank you, yeah.
that was a win.
Okay.
Alright, and then these are just some of our daily meds, just numbers, how many meds we give out each day to students each of the schools. And these could be, some of our students take a morning med and then an afternoon med, so this could double. And then we
So
also,
those are scheduled medications
Yes.
that every day happen.
so like ADHD meds, diabetic meds, anti-seizure meds that they take preventatively, all that stuff. And then we have our PRN meds, which includes emergency like EpiPens, albuterol, and as needed PRN ones, which is like Tylenol for cramps or headaches, Tums.
Cough medicine.
Cough medicine.
Yeah.
So those are all in there for each school, and those are all specified for each specific student.
Alright.
Um,
So you wanna talk about the
yes, so last summer, we started talking with Freighter and the Medical College of Wisconsin when we had a table talk discussion in January about emergency preparedness between Valley View Elementary and Freightert. And then we initiated, it was myself, I think Dan Gabauer at the high school, Jenny Tamlinson at Valley, and Dr. Munoz or Mr. Munoz initiated having interest in Stop the Bleed kits in our classrooms and student areas for traumatic bleeding events. And then we coordinated with facilities and Freighter to apply for a grant to see how many we would need for each building or classroom for the middle school and high school to start out with. Common areas like the cafeteria, gym, office, each classroom. And we applied for a grant and we were awarded $2,500 in September to use towards that full package that we wanted to purchase. And to purchase all the kits for the middle school and high school, it's about just under $7,000.
Okay.
So we're still working on getting funding for the
So
rest
we've
of
got
it.
plenty of
Sure.
record data, how many we need, where we need them, so.
And that's just for the middle school and high school, that doesn't include any of the elementary, so like it's still a work in progress.
Sure.
But we have some, which was really great that they awarded it to us.
Ideally, what we'd like is in every one of our crisis response team members, basically, their go bags for emergency response, like I was stopped to bleed kit. It's gonna be a lot when you talk just at the middle school and high school, generally you're looking between 10 and 15 people in those medical response teams.
How long do those kits last? What's the shelf life?
I've looked into that, cause a lot of ours in the past had expiration dates, just because all medical equipment has an expiration date. I looked to find on the actual Stop the Bleed website, one of the trauma coordinators at Freighter helped me with it. There is like a general kit for like $40 that comes with like a tourniquet, gloves, and like gauze that really don't expire.
That's
Like you can still use it, like
Yeah.
the gloves might not be as
Yeah.
stretchy or something, but
But
like,
it would be fine.
so I think it'll be
Yeah.
fine,
perfect.
maybe 25 years down the road, probably not, but like,
But I feel like
never
at least
know.
it's a good ROI where we're not including materials that do
Right.
have an expiration that
yes.
then we have to supplement and look at this from a
Yep.
rotating budget
Right.
standpoint, but that's great
And,
news.
and the staffing to maintain that.
Correct.
And we've talked about that with AEDs, like the
Yes,
batteries
we
on
have
certain
talked about
AEDs will go, and then the price of the battery is actually more than what the AED is.
Oh.
So that says we start looking at more grants down the road and what we can help fund with it, that's one of the things that ties in. This one, we've got the funding covered, we just need to coordinate where and how many we need.
Yes.
Exactly, yeah.
So we have a full year to use the money, so we're kind of just still waiting for specifics of what we actually wanna do, so.
Perfect.
Alright,
Stock over the counter meds, this is a new thing that we started this school year, which was very exciting for me.
Mhm.
Because I have those upper level kids, middle school and high school, and this has been a huge game changer for us. So at registration, parents have the option so they have to answer this question, that they either agree or do not agree for their child to be given a recommended dose of either Tylenol, ibuprofen, Tums, or all three as needed. So as needed, not meaning like every day they need it for a headache, but as needed like once in a while. They need it and that we can give it without calling, having them fill out a paper, come in, bring the medication. Almost everyone, I've only come across one parent when we're trying to check on students that has said no. Otherwise, they have all said yes.
Which is great.
And we are giving a lot. That may sound like a bad thing, it's actually not a bad thing.
It gets them back in
It's
class.
a good thing, it's keeping them in school, it's
Sure.
getting them back
Supports
in
the
class.
Yep.
And I thought, okay, maybe it's gonna take a while, cause we've spent years saying, I'm sorry, we don't have medication we can just give you. Now, literally, we didn't really have to spread the word, I mean, kids know.
yeah,
And so they come in, can I have some ibuprofen, I've got cramps or whatever, especially cramps, I mean, there's a lot of menstrual issues. It's keeping these kids in school, so I'm quite excited about
Yes.
it, it's been a fantastic addition.
And then I'm assuming it's helping at the high school level with athletes that are doing
Oh my
high
gosh.
performance and
Oh, yeah,
they're recovering from injuries or whatever.
absolutely,
awesome.
absolutely. Ice, ibuprofen, and send you on your way, but
Bingo.
you stay in school.
Right.
Yep.
Which is a huge battle at the middle school and at high school level, keeping these kids in
The
school.
dreaded tummy ache.
Oh,
I'm gonna
yeah.
play that against
Or
the-
headache
Yeah.
all the time.
The dreaded Monday.
Yep.
For kids. Project Adam, so I was gonna bring in, I left it in the truck, I'm sorry, but we just got the banner.
Oh, nice.
So, this is something Alyssa and I have been working on that is also very exciting. So Project Adam designation. We achieved at the high school and we're gonna go through all the schools, but what that basically means is that our school has an emergency response team, emergency medical response team that is trained to respond to a cardiac emergency where there's someone is not breathing and they do not have a heart rate. So that involved us working through having the right number of AEDs where no matter where you are in the building, you can get to somebody. So we have an AED out in the press box at the football field. We have an AED in the cafeteria. We have one at the auditorium. We have one on the second floor, and we have one in the basement by the pool. So we have a lot of AEDs at the high school. We added 3 last year to be compliant. And then we went through a whole training program which involved a list of things that we had to complete to make sure staff was trained, that everyone knew about the AEDs, that they're stocked appropriately. So, and then finally, we had to complete a drill. So we had to have the emergency response. We scheduled it on a non-school day, but next time they actually recommend that we do it
During the story.
during a school day,
Okay.
because that's more realistic.
More
And
normal
busy,
distractions. Mm-hmm.
noisy, and then you have to deal with crowd control, and so that's what we will do next time we do it, but we did it, and yeah, so we've got a really nice banner that will go up, and
And the Falls Fire Department helped us with that.
Yeah.
They
Oh,
came to,
Feedback.
yeah,
Came
and
to the
they gave
training.
good feedback, and so yeah, that was exciting.
When you
too.
say did the drill, was that part of this June drill?
No, we
this
just
was-
did it.
this was December 2nd.
Okay,
We just
perfect.
did this drill, yeah.
So this drill needs to be done every single year to stay compliant, as long as maintaining our medical response team, which has to have at least 8 to 10 members.
Yeah.
In each school, that can respond to anything
They'll be
medical emergency.
CPR, AED certified.
Yep.
To be on that team, and so right now we have the high school team together and good to go, and next is the middle school team,
Yep, hold on.
getting them ready, so.
And then your health room assistants are on that team?
Yes.
Okay.
Along with administrators, our SRO at the middle school and high school.
Yep,
A lot
Okay.
of our social workers are school counselors as well, just because they have
yep,
access.
generally the secretary,
Sure.
to, deal with the phone calling and,
What we're looking to do is build those teams up
Good
for
system.
different locations, the buildings and all the
Yeah.
buildings too, and we'll talk about that a little bit with some of the looking ahead stuff too.
And it is, you said 10,
8 to 10
8 to 10
members.
roughly
members.
8 to 10 members, cause at
Roughly
any
depends
time,
on
they
the
may or may
number of
not be in the
kids.
building, yeah,
They might have a class they can't
they
go
may
away
not be
from.
there.
Oh,
or-
sure.
So you wanna have more trained in hopes that maybe you get 4 or 5
Mhm.
that can.
available.
Yes,
that can be-
right away.
Yep,
So it's great just to turn people away versus needing more people come out. So-
Right.
Especially when you consider the how big the high school is and what kind of
yes,
footprint that covers.
yes.
And I think you were talking about this at earlier meeting, that you usually have to like lure people, and it was unusual to see the big compassion of our staff.
Yeah.
That people are like, let me know how I can help, which
Yeah,
was,
Liz, do you want to come to you?
Yep. that's awesome.
You can click.
Alright.
So trending diseases and injuries that we've gone through, pertussis, which is whooping cough, which is a reportable disease to Waukesha County. That is by law, we have to report it if we get a confirmed diagnosis. Otherwise, mostly doctor's offices usually take care of that pretty quickly. Otherwise, it's a phone call between us and Waukesha County to coordinate with them. So we've had one, these are confirmed ones, at BF, 2 at the high school, 2 at the middle school, none at Riverside, 1 at Shady, and none at Valley, which is great. The big thing this year is the mycoplasma pneumonia or the walking pneumonia. These are the ones that we know of confirmed as of last week when I sent this in. This is
Okay.
probably doubled. These are the ones that are confirmed that like they tell the secretaries.
Sure.
There could be 20 more kids in each
Same
school
with
that we don't know
pertussis
of.
too, there's a lot more
Okay.
pertussis, cause they're
It's a
actually
lot
not
of them.
testing, they're just treating.
Yep.
So we don't know about a lot of it now.
So it's a lot going around. A lot of this is just disease prevention, like basic stuff like hand hygiene, staying home when you're sick, covering your cough. But it's very easy to transmit to person, student to student, so we see a lot of it. Fractures during school hours or from school, none at Valley, 1 from Ben Franklin, 1 at Shady, 3 at Riverside, 1 at North, and 0 at high school. So that's from
And those could
school
be
hours.
Interactions or slips, trips, falls. it
Yep.
can be
Yeah, and these are
variety.
just
Okay.
ones that, yeah, for
Right.
sure that we
This is from the
know
beginning of the
about,
year.
yeah.
This
Okay.
isn't from
Yeah.
last, this is just from September.
Yeah,
Okay.
But there's obviously more that happens outside of school.
there's
Like we've
happened,
had-
yeah, that, I know there are things that have happened, but yeah, we don't necessarily, it's not during school hours. so.
Right, someone falls off playground equipment
Or during
something.
sports practice, things
Yep.
definitely have happened, so.
Sure.
So we still help with those injuries the next school day, but not during, like, what happened during that school day.
These are some things that we would like to look forward to do, possibly getting stock bronchodilators, meaning albuterol inhalers, so we have stock EpiPens, stock Narcan. And it would be nice to have, so the next most important emergency medication would be inhalers. That we would have to give students that have asthma, we have a lot of asthmatic students that don't bring their inhalers, don't have them.
Insurance doesn't cover 2 of them,
Yeah,
1 for home, 1
Yeah.
for school, they have to pay out of pocket, which is very expensive.
Okay.
we would keep
So
those
that's-
located as an emergency
Sure.
in the health room, in our emergency bag, which is what we do right now with our other emergency medications. And
how-
then, yeah, designating our other schools with Project Adam and,
Sure.
like Dan was talking about getting maybe a few more portable AED units.
We know for sure we need one for athletics for the trainer when they're going back and forth, and that's one we're gonna focus on, but ultimately the goal for preferably by the end of this year would be to have one AED per main office. When you start talking about the 3 floor levels, even in like Valley View, how we have one for that 3 floors really to cover, that's not adequate enough. So really, we should have one in the main office, cause that's gonna travel with the crisis team. But ultimately, we need more, that's for sure. We found some good deals, we're still looking to find out if we're gonna be able to get some donations to help cover that. Cause there was a couple of conversations about some of the medical providers in the area helping us out, kinda like what Frater did with their Stop the Bleed kits. The other thing that you guys aren't bragging about on here is that Pamela Lisser also volunteered to be CPR AED first aid trainers, to go through the training, to become trainers, so they'll
So
be
you
the,
will certify staff as
Yep.
licensed practitioners, awesome.
will be the 4 of us, it'll be us 3 and then John D'Amato, because he's
Okay.
actually gonna be needing, every coach needs to be CPR AED qualified.
Sure.
So that'll help save some time, it'll help save some money, but then it gives us an opportunity to provide training to staff during the day.
Yeah, during the school day, so we'll
Which
go
is
into the
nice.
building, so it'll be better for them.
Awesome.
Early release Wednesdays,
Good service.
Yeah.
staffing service days.
Yeah,
Because again, our whole goal behind all of this is the more people that we get CPR, AED, and especially even first aid certified or trained, the better off we're gonna be for our kids.
Right.
Response time goes down, we're gonna have more people that are able to provide quick, adequate service. And then, again, and then the big picture of things, every single member of the district, it would be nice to at least be compression only CPR trained. Not everybody needs to be CPR AED if we've got our medical response people doing that too. But that's kind of the big picture, you know, like David always says, that 30,000 foot view of what we wanna do with the whole district is we want everybody to know how to treat, at least give CPR compression only.
Yep.
AED first aid is gonna be more of a specialized thing for our medical response teams, us. But then the training piece of this too, with what we're able to deliver versus having to, you know, have an outside source of. And we got built-in people and staff members that are gonna have that expertise and background knowledge of it, the better off we're gonna be.
Right.
So it's just a really nice thing that the community rec is offering the 4 of us to do. And Jackie is, you know, she's been a trainer for a while and she's pretty excited to get us on board with that too, so it'll be nice. 'Cause
Awesome.
right now it's just her at CD and rec doing it. And the fire department on the side too, but otherwise everybody's gotta go to Red Cross, which is, it's expensive quick.
Sure. Okay.
That's awesome. Thank you,
so
Denise.
much.
yeah, so that's,
Anything
that's it, yeah.
I don't necessarily have any other questions. The only thing that came to my mind was when you were looking ahead at getting some of those bronchial inhalers and having it with those emergency kits, how many would we want to start with?
I think we'd have to kind of talk that through, I would say for sure 1 at each building.
Yeah, so at least 6,
Yeah, if we had at least 6.
because
Because
we
then
have,
you have an emergency,
they go to the
Just
health
as part
room.
of our
Yeah.
emergency, you know, response, you know, that we can have for students.
And this was a new Wisconsin act that was passed this past March, I think it was, that all public and tribal and private schools in the state of Wisconsin can get a stock prescription from their medical advisor for albuterol inhalers in each school, however many they want.
sure.
So it's just
Do we know what the
coordinating.
cost is?
From what I looked at last, it was like $30,
Okay.
which is not bad at all, because they
Right.
usually last a year and a half, 2 years, and they come with like 200 puffs on them, like a normal one.
Yeah,
And these are for like kids that like they forgot their inhaler, are having a really bad coughing spasm, or that they just
the
need.
only thing about this is that, so, you know, this is a one-time use,
Yeah.
so we buy this inhaler and we have to use it, well, now we maybe put that kid's name on it so we don't throw it,
Right.
but we cannot
Right.
use that for another
I
student.
was just gonna say, how does this work when there's 200 uses and then
Well,
is
you-
that just
you-
our gift
once
to the
you use it,
kid?
Like,
this is
like,
not like ibuprofen where we can keep
Right.
just doling doses out, so,
And since
but
this-
it is for
yeah.
an emergency, so.
Right. So
Not
just
like
need it
Johnny's
to-
having a little bit tight, you know, in that case, we're gonna call mom. We're only gonna do it when we've got a student who is really in a crisis. And we have had that happen, you know,
Mhm.
last year up north, where we had a student that, you know, I was very close to calling 911, you know, if that parent did not arrive as quickly as they did, because,
anything.
no, and to take them, it was beyond an inhaler, so it had gone too far. Where if we had had something, we could have still had to send the child out, but it wouldn't have been as much of a crisis as it was.
That's what I get into.
And this, since this is new, it's kind of the trial period with other school districts and seeing what they do, what works for them, what doesn't work for them, so we're kind of just
Do
waiting
you
to
have
see.
relationships with folks like yourselves at the
Yeah,
other districts in
we can
Waukesha?
reach
Okay.
out to different districts and, ask them what they're doing and kind of, that's where we get,
Ideas.
ideas and schools that have already
Yeah.
implemented different things and they've already, we're not gonna recreate the wheel, they've already gotten a nice
Yeah,
policy
For
and we
our
kind
stock policy,
of
I
use
think
some of
we-
those as models.
I think I literally copy and pasted it from Field
Uh,
and just changed it from Menominee Falls.
Yeah,
Yeah,
I
we'll
mean, there's
find
another
different
thing
ones
we
that
did put on
are
there too.
great, yeah.
They rewrote our concussion protocol, our sudden cardiac arrest protocol, so that went before policy, so Pam and Alyssa were involved with that. And really stealing it from.
Yeah,
I mean, collaborating with.
Yeah.
I from a flattery.
Right.
Why
Why would we create when there's
Right.
already a really
You bet.
great, that
Yes.
gives us everything we need, then
Yep.
we'll
And
use
it's
that,
working,
yeah.
and it's working for them, so why wouldn't we?
Yeah,
Yeah.
exactly, and other districts do the same thing.
Oh, absolutely.
That's awesome. Well, thank you,
Yeah,
ladies.
thank you so much for
We
taking the
appreciate
time
the
to come
spotlight,
and
thanks for what you
Perfect.
do, and good luck as we continue to battle. All I hear is people are falling down with bronchitis and.
Yeah,
a lot of high
I
schoolers
just saw
have a lot.
someone, a parent who happens to be a teacher in another state on my Facebook said that for 9 days she's been fighting and she finally went and got meds.
Oh,
And
gosh.
she has walking pneumonia and bronchitis.
Yeah, it's really
all
common all
over.
over. It's still a result of COVID. This is still from COVID, so still when we suppressed all of these viruses, so this is still why we are having repercussions still of COVID, which is kind of crazy.
There is something to the whole group immunity, like get it
Yeah,
out there and make it
There
work.
really is something to that, yes.
That's why immunizations are great for
And
99%. Do you need anything else?
No, you guys are
Okay.
good to go,
All right,
and
thank
you very much.
you.
Guys,
Appreciate
thank you for your
your
time.
time this evening.
Thank
no
you.
problem.
Have a good night, guys. Hope
You too.
you won't have to worry about not enjoying it.
Okay.
That was a lot of really good information.
Yeah.
They're doing a great job.
We lost, oh, you just mentioned it.
Okay, so moving on to attendance.
Well, this one is more of a disappointing thing than I think anything else, because one of the things we had planned to do, and you guys have heard me talk about since we began piloting at North in the high school, the parent portal, is that we wanted to take off in January with that and start doing it at the
Yeah.
elementary level. Because of the way the state reporting works for elementary school, only twice a day, we don't have it structured in our system to take the portal for first and second blocks of time to do that yet. So, and this is from the Bell schedule, the way it's set up at Oliver Elementary School from 17 years ago. So, it's just the way it is, and partly due because of the way state reporting works, is that the elementary schools only have to report twice a day. So, next year, and we've already got a plan ready to go for the fall, we can't change anything in the Bell schedule at the elementary school until we do our rollover for the entire district in July. So because of that, we're not able to do the parent portal. But, having said that, the nice part about the parent portal is that parents can still look at their attendance and still check on their students' attendance, that part is still available. They
Okay.
just can't input it yet.
Okay.
So I guess making lemonade out of lemons, we'll be able to do a more detailed job on communicating out the process. And all the stuff that we learned from the pilot that we've already sent out from communication, we'll be able to do it even better for the
Yep.
elementary level and just have more reinforcement behind it.
Does that give you just a little bit of a lag in terms of having the whole district be reporting the same way then as a result, or are you still getting the level of
We'll
detail?
still get the reporting, it's just it's another option for parents to report, so it
Alright.
enhances their accuracy.
So
at
it's
the
more
school level.
about parent experience than it is your quality of data. Okay,
And
that's
it
good.
will lend itself toward better data at some point, because they're gonna have another option to report attendance problems.
Yep.
So I'm gonna use the messenger as, because we did still run with the messenger at the elementary schools. So let's say I'm a parent and my student is missing for first hour, I forget to call them in. Messenger service triggers that, hey, you've got to call your kid in, so then the parent portal would give them another opportunity to do it instead of having to call or email or something else. So that it would just be easier for them to use their phone or do it on their computer to report it. So it's a little delay, but it will be
Sure.
rolling out in the fall.
Sure.
So we'll be ready to go with it, and based on what we've learned from Power School in the last probably 2 weeks, we should be good to go for the fall.
Okay,
Awesome.
that sounds good. Thanks for your
I just
work and follow.
got a bum, but it is
Of
what it
course.
is. You know, it's just, we were
It always
prepared.
comes down to like system configuration, so it sounds like you'll be able to configure what you need to, but you have to wait till July. Will be requiring changes in software, or is it totally
Nope, it'll happen during rollover.
perfect?
Yep. So as soon as rolls over, the goal will be we do the parent portal, we communicate everything out, as soon as that rollover happens, we'll know immediately we can do it. And it's about changing the bell schedule so that we'll have basic first chunk in the day and second chunk.
Maybe think about, for the back to school fair, promoting attendance. Because whatever you will have will be in place for the district, and so you'll have all the house rules, that'll be a big change for the, new incoming parents, but then now parents that have kids at multiple schools, they'll all be working the same way.
And actually, kind of like what we did at the high school and middle school with the, we had the admin assistants there, doing demos.
Yep.
With the computers too.
1000%, so then you
Yeah,
can
which
actually
is
teach them and have
great.
available the brochure or whatever
Yeah,
here's how to do it.
Yeah, the flyer directions.
Yep.
And I think that gives parents peace of mind too, when you know how to communicate.
Yeah.
With the district and
And that you can do
feel
it.
confident in that accuracy and.
And you can say, here's our district goals, and you can talk about why the goal's so high, and here's how you can do it, and ease of use to be able to hit our numbers.
And honestly, it's gonna be better for your kid, cause the more kids in school, the more they're gonna learn, so that works out better too.
Right,
Alright,
all right.
so the next one on there then is, we've got the log entry process. The last school that's gonna be rolling it out and setting it up for teacher pilots is gonna be Riverside. And we've got that meeting scheduled for Wednesday. So,
Okay.
Kara, our Power School guru, is going to be visiting with Scott and Dave and walking them through it. Dave's already had a little bit of a tutorial on it from working at Ben Franklin. And there's teachers that are starting to pilot this process like they've already got in place at middle school and at the high school. So we're slowly working towards our 4-step process that you're gonna see on the actual, I can't remember what we call it, not the pillars, but our action planning document that we did it back in November. So
Sure,
there's gonna be, we're headed towards the process of keeping that complete.
all right. And then survey of communication tools.
So this is a survey we're gonna be sending out, that says copy, but it's the survey we're gonna be sending out to staff at the elementary level, because again, one of our goals is to narrow down and make it less complicated of a process at all the schools for parent communication with the buildings and especially at the teacher level.
Right,
So we're gonna be surveying the staff and try to narrow down what it is we're gonna do at the levels, at the elementary level overall to one specific app. We're gonna, in the actual survey, you'll see there's a lot of different ones. We're trying to see what works and what people are having the most success with. And if we can find one for the elementary, perfect. Otherwise, we were kind of talking about it even today, if it's K2 and 3-5, even if we separate it like that. As long as there's a uniform experience at those levels and at those grades from building to building. What we don't want is one K2 delivering something different than another K2.
each classroom essentially could be different
Right.
at this point.
And that's what we're trying to avoid.
And every parent is like, okay, so this teacher's on here, this teacher's on here,
Yeah, how many apps do I need?
And it's enough for the sports apps, I know with the coaches, they all have their favorite, and then you add in
Yep.
every teacher having their favorite. I think this is a great idea, and it gives parents, again, that expectation of something that's easy to receive information, you get that notification on your phone, you don't have to download 10 apps, you can download 1 or 2
Or even
depending.
learn 10 apps.
And
Cause every one of them got their own navigation
Correct.
issues. And that's one of the things too, I mean, the systematic thought process with athletics too, with coaches is, let's get to where we've already got, we're gonna protect you and the district by doing this on something that the district owns already.
right,
And again, it's good feedback, we can get that loop going where everybody can communicate with one another. I agree, Sarah, that's.
when is this survey due back?
So we were looking at doing this right when we come back from Christmas break, and then taking those results and start again, kind of semester-ish, right at January. Elementary doesn't really run in the same semesters like the middle school and high school, but somewhere around that time frame, where we're gonna start looking for more feedback on what it is. Okay, we've narrowed it down to 3 or 4 different apps. Okay, let's start evaluating which ones these are. Some of these apps that are being used out there are not necessarily education good, I guess.
Sure.
They're not really versed for education, so they are being used because the people are using them the way that works for them, but there's some better ones out there, so.
Well, that's probably just it, they phoned a friend or they've got a spouse or family member who is using an app and then they just, if it's homegrown. So
Yeah.
to your point, what's the problem you're trying to solve? Do we already have it here in the district where we can cross-train and have simplicity? Or are there needs that aren't being met and you guys have to do some analysis to find out?
That aren't potentially putting the network at risk for a
Correct.
attack. That's another aspect of
Also,
this.
right, and that's legitimate because there's a lot of information there that needs to be kept safe.
Heck, yeah. Yeah, and we're getting it, if you ever go to MATC Truex, and there's a computer course there off in the protective services building, right above where the nurses training is. And they have 2 screens that are constantly just showing all these attacks on our country, from where they're coming from and where they're going. And it's tens of thousands a minute,
Sure.
just attacking everywhere, and we're not excluded in the state of Wisconsin from that.
I went to MITC Truex for 2 years, so that's on the upper east side of Madison.
We're by the airport, that's where my first degree is from there.
We probably-
To the Army, but-
Yeah, well,
We'll catch up on that. The campus is amazing now,
Yeah.
it's really something.
much better than when I was there.
Well, I'm excited for that too. I think it'll be good for everyone involved, staff and students and parents.
Yeah, really, I mean,
So-
systematically, it's gonna be, that uniform part is gonna make things a lot easier.
Yes.
Yep, and hopefully lend itself towards, again.
And part of that
Well,
5-year
and again,
strategic
you
plan
just-
pillar
You
getting,
keep thinking of all the perks, like, hey, if we have a teacher that leaves one school and goes to another school, that's one less learning thing that they have to adopt, and it's just, again, standardization is helping make our staff more efficient as they move around, so.
And you heard it from the nurses today, and not just our nurses, but our social workers, psychologists, our counselors, they do so much collaboration building the building. These guys are traveling building to building, and they're having to communicate out.
well, and having sister schools, it's imperative.
Yeah, for sure.
Yeah.
That common experience from level to level.
Mhm. All right, great. So yeah, looking forward to results in January and then kind of breaking things down from there. So that'll be good. All right, moving on to CPR AED first aid instructor coursework.
Yep, and you heard me talk a little bit about that when the nurses were doing their presentation. So we are gonna be getting certified through the CE and Rec department. And again, with the ultimate goal of getting our medical response teams trained minimally, but ultimately as many people that wanna get trained as possible. And for the district to be able to cover that, that is just a nice benefit for people, and they are excited to do it, which is really nice too.
Yeah.
And for it not to cost them, anything to do it, to get CPR certified, we pay for the card pretty much, and that's it, and we can train everybody ourselves.
Sure.
Really nice. So between the 4 of us and Jackie at C and Rec, we've got a lot more opportunities and timeframes where people are gonna be able to access this in the training. So it's nice. Pretty exciting.
Yeah,
It is.
absolutely. And then moving on to the crisis communication plan, I know that there's a lot of information here.
So, and this is a thick book.
Right.
So this is part of the work that we completed today. It's almost 100% done with every single building in the district, and that's our safety plans for the district and then for each building. This piece is directly linked to that, and this is a really about as succinct as you can get on what options we have when there are different things to do. So this is a resource not only for our building level principals, but also for us at district office if there's ever incidents that need to come up. And some of these have already been used. For example, our fire alarm that was going off the high school multiple times, Ms. Taylor utilized the document that's in here to send out information to families too. And then Jen at the high school also did that. So this is something that's already in play. We've taken pieces and chunks of it and we've pieced it together. Now it's completely one piece, and it's a lot of work, but it's done.
Right,
Fantastic.
yeah, and the table of contents and having everything, flow, it does help try and, when you're looking for something, make it more succinct.
One thing you are gonna notice, like the templates, you're gonna see a lot of similarities with those templates and what we did in our flip charts.
Mhm.
But you're also gonna see next month, and this will be more closed than anything else. Excuse me, you're gonna see the similarities with what we do for safety plans, our top 10. So there's gonna be pretty much everything on here, but this has got a couple other things that come up. But our top 10 that we use in our flip chart and on our sub chart, you're gonna see next month.
And then how frequently will this be reviewed, annually?
Annually, yeah. So this is now part of the safety plan updates, and I told all the principals today, even though that the state only requires it every 3 years, we as a district are going to be doing it annually. It's just good practice.
Especially when you start looking at some of the specifics around names and
Yeah.
phone numbers, you're like, man, you'd hate to be in an active service and see, hey, we may need some of this to figure stuff out, so, perfect.
Right.
And with this is one of the components, and right now, and Isabella and I were talking about this afternoon, we have 3 binders right now that are encompassing all of our crisis plans. So this is one component of it, the other component being the safety plan is about 40 pages, I think this was about 48, maybe a little more, 60.
63.
63. One of them's
64.
38, so we've got a 68, we've got a 38, and we've got something else in the 40s, so those are gonna be all digital, everything's digital,
Yep.
so it's all one, not a binder, but it's one
An electronic
document.
resource.
Yep, one resource.
And are you having them, is there a way to like systematically have it be bookmarked to their desktop
Yeah.
or bookmark, okay, perfect.
So what we're looking, and this is part of Raptor, and this is one of the battles that we've been fighting technologically with Raptor is right now having access to our action plans, once we get those together, our administrators will have access to that on here. Just our administrators for the safety plan component, because that is really considered to be more of a confidential document.
Mhm.
It's not really like a public document because it's got so many of our responses to emergencies, we don't really wanna
Right, I agree.
our stuff out there. But when you look at the things that they're gonna have access to, this is gonna be a component of it, the action plans are gonna be a part of it. So I think that when we look at that as a housing for our information, it's gonna be in Raptor.
Awesome.
Everybody's got it in Google right now, but from an administrative standpoint, we've all shared that, we've got access to each other's. But we want something that's gonna be more mobile on an app. But not real keen with Raptor, I think you guys have heard me say that before, and I think we're gonna be exploring once we're out of this contract timeframe, a little different options. But we also have to balance out how much training that's gonna take to convert to a different platform.
Sure.
But right now, I've had too many experiences with Raptor and emergency management system and too many experiences with other ones that have been more positive. It's not that they don't try, it's just they don't do.
Well, and you want to know the tool does what you expect it to do in the heat of the moment when you're trying to,
Utilize it.
Right.
And even during our training today, that was quite a bit of conversation about what are the issues, when we drill, what's our number one issues, and then so far, it's always that same platform. I
Okay,
love them for visitor management, I think it's probably the best visitor management platform that's in the market today. But when it comes to the emergency management systems and their platforms, it's very, very much lacking.
okay,
So there's some things that we're gonna be exploring more with them, but also with other vendors, because again, it's free market, and if what we're paying for isn't getting us what we want, we're not gonna keep paying for it.
right,
And they've heard me say that to them many times this year, they shouldn't have to, they should just meet our needs,
right,
so.
right.
this far supersedes my personal expectations, like, I know that this is for our internal and our leadership, what would be lovely is somehow to have a summary, and here's the why part. Part of the challenge that came out of some of the parents when things were going off the rails at one of the elementary schools was, we don't know what the call order is, we don't know who, are we supposed to tell the teacher, teacher tells principal,
Yeah.
like, and if I'm not getting my needs met, like, this will satisfy us on what we need to do from a staff perspective. I still think there's enough, and maybe it's in here,
Have you seen this? And actually, I say that because Valley View just sent it, I don't know if I can pull this up.
and if we did do one, that's awesome, but all I want is, we didn't have stuff like this before, I'd love you to get credit for it, I'd love to be able to demonstrate to parents that we invested, for harmony's sake, that's a lot of effort.
A lot of hours, a lot of
That's
hours,
Be able
yeah.
to make sure, and
Again, it's a lot of collaboration,
correct,
because and the Donovan Group being a major part of that as well.
agreed, oh, that's a nice little gadget,
Let's see if I can get this thing actually coming in, there's a full screen version of this somewhere here.
it says open with photos, I wonder if it open with PDF,
The PDF, may get better, there's that a little better.
maybe, yep,
Let's try that. So this is, it's really about utilizing chain of command,
Yep.
right? So often when you get to an issue that comes up and the parents don't know who do I call? What do I gotta do? What do? They call whoever they know, which is you, me, David,
Right,
whoever that they come in contact with.
or even at a school event,
Yeah.
I had this situation, let me bend your ear,
Yeah.
or,
Right.
Which we don't mind, but
course.
ultimately, we're not in the position to solve the problem for them as easy as what
so
people
then
are
I've been in
there.
the position of being like, you should talk to the principal, or
Yeah.
that's a building.
You
I think
bet.
I say that 5 times a day when it comes to my children who are upset about something in their day, and I'm like, did you talk to the principal?
Well, advocate for yourself.
Right.
It's good, I'm not the only one that did that. Cause some of the kids would come to me who is the principal, and I'm like, talk to the teacher? Well, no.
Right,
I'm not gonna fix all your problems,
let me
kid.
show you the map,
Let me show you.
Yeah.
that's awesome.
So, as you look at it, again, it really is a chain of command process, and you start, okay, I got an issue, I got a question. It doesn't have to be something bad, it can be
Right.
something good. So you're gonna start off by talking to a teacher or a counselor or someone else in the building, whether it's a student or a parent that have these concerns. So then if it's not taken care of at that, but there's something else that needs to get done, okay, we'll jump it up to the principal.
Yep.
And then if that's still not gonna go, then generally it's gonna come to me. It says the Director of Pupil Services, Student Support Services, it's just easier to remember.
Yep,
And that's
sure.
my number, and then if I can't handle it, then it's gonna go to David, so then he'll get involved, and there's his number. And again, last on the whole chain here would be if we can't get anything resolved at his level, then,
And I noticed that we were left off.
yeah,
Yeah.
that would be the next piece. And that's somewhere along that process we get communicated down.
Yes,
Right.
But not this, I didn't want it to come up, but that's okay. This is just one example of one of our
yep.
pieces of the
emergency
puzzle
map,
that
yep.
have come up from the day. That's our, one of our emergency maps that we utilize too, so.
Awesome.
But that really is a process that not many people utilize it, not just because it's inconvenient, but just don't know. And it's like,
As I
I know you, I know me, and
Right, I think part of it is we haven't done a good enough job to train our parents and our families on it. So if people are sending out newsletters, that's probably one way to do it, but it's always something to maybe consider for the back to school fair
Yeah.
of, hey, are you aware this is how escalations work throughout the year? And
Yeah.
not even just escalation, like you said, to get questions answered
or a
about,
compliment,
yes,
you
exactly,
know?
feedback of any kind.
And as a teacher, I loved it, if someone, as a parent would come and talk to me, hey, I just wanna let you know, my kid really likes you, and you're doing a great job, something like that. And then what I'll do is usually bounce it up to change it, well, you should tell my principal that. Tell them.
Yes, exactly.
I got an evaluation or observation coming up.
Here's my
next week.
principal's card.
Yes.
Give him a call.
That's awesome. No, thank you for all of this. This is incredible.
We didn't see the safety plan.
Oh, I'm sure. If-
And we knocked it down about 30 pages today too, so
Oh, good.
it was a little excessive for some of the stuff that they had tied into it, but again, it
Sure.
depends on what our needs are, that's the nice part about being a member of a safety organization in the state of Wisconsin.
All right, scorecard information.
So there are a few updates in there, this is, again, like we said before, we're gonna be having this as a running item on all of our meetings. This is, I can't pinpoint which ones exactly got updated, but I've been, as this is a living, breathing document, I've been slowly plugging
Right.
stuff in there. There's some survey thing I just thought I might add that our elementary, I think this might be the survey right there. Yeah, so there, it is updated, and as I'm going through, it's just a matter of remembering that while I'm doing something that's on there, to plug it in, so I don't forget about it. Because it is a lot to do and type at the same time, and we're trying not to get overwhelmed with the typing,
Correct.
do more than doing.
Right.
So it is
But you
gonna be
don't
an
want to lose
interview.
sight of the impact you're having either, or you're trying to keep a lookout, so.
I do wanna keep you guys informed with it, but do know that part of it, if it isn't on there, is getting done, it's just I haven't had a chance to document it. There are some things that are popped in there already.
Sure.
And the wall is getting more and more updated, and a lot more green on it than red and black, so
Oh, that's great.
it's working good.
Yeah, that is good, yeah. One thing at a time.
Yep.
I know looking at the 5-year strategic plan, it's just working through the foundation on some of those and then getting it to the next level. And that's why it's a 5-year. Because it'll take
A couple of years,
a
at
couple
least for a lot of
years.
these things.
Mhm.
You know, David and I were talking about the virtual school and alt-ed schools and some, not school, but some of the alt-ed work that we've had experience in. And that is gonna be a big ticket item. And when you talk about how many different pieces that puzzle is gonna be encompassing, where a lot of people hear alt-ed, they're thinking at risk right off the bat. Alt-ed isn't necessarily just all at risk, it's gonna have some components in there, but you also have gifted and talented that come in there, we have virtual learning, we have all sorts of different things, so. I think as you look at, we'll be going and spiraling a lot of different contact pieces when we start looking at that alt-ed experience.
But I think what you just hit on was the why. So when it comes to in terms to people to ask why we chose to fund it, why we chose to prioritize it, you're including the fact that, hey, now we've got some dedicated resources to our gifted and talented programs, which truth be told, we do have a lot to offer at the high school level, but how does that carry out throughout
At
the
the
lower
lower
levels? And then it gets to the whole point of, hey, it's helping with those that are lacking and needing some additional support. And then it's an extension of coursework for those that are hungry to learn more, so.
Or even if ones that aren't brick and mortar kids,
Correct.
you know, where we could offer them something virtually.
Correct.
And maybe not even on our.
That's true, who
not
want
in our
access to
village.
athletics but wanna do study at home,
Yeah,
so.
who wants to open enroll to us through this because we offer a virtual program that they can't get in their own district. And when you think about how many are right now in the state of Wisconsin that are out there, how much money is being transitioned from, like say for example, Menominee Falls to somewhere up north, a district up north that's offering a virtual learning platform that we don't.
Yep.
And we're losing kids that way.
Yep.
So I think that's, when we start looking at dollars and cents piece of it, that's one component that'll help fund all the rest of the things we wanna expand upon for everybody else too. So I think there's a lot of opportunity for it, for sure. It's just a matter of finding what's gonna work for us.
Correct.
And,
And there are a lot of programs out there.
yeah, but what's the number one thing? The staff member.
Yep.
Cause everything hinges, when you got all that program, it all hinges upon the staff.
I was just say, you're gonna have to
Right.
figure out what the right staff model is, because now you're proctoring education, but you still need to have oversight in a classroom for tests, exams,
Yep.
quizzes, projects, whatever, so.
The guy on the side.
Yep.
Yeah.
Oh, good.
All right, and last but not least, future agenda items. So we have the district and school safety plan for all buildings, Donovan Group, mid-interval presentation.
Oh, associate principals, that was one too.
Associate principal presentation, and then not necessarily, we don't need to hit on this right away in January as we're getting the information back on the communication.
Yeah.
But eventually, circle back to the survey of the communication tools, what worked well and what we decided to go with, and is the thought then in the fall,
Rolling out with it.
Rolling out.
Mhm. I think in the Donovan Group piece too, one of the things that we just did at the end of last week was, we're gonna be tying in our survey in with the Studer Group survey. So the parent satisfaction survey that goes out from here every year, we're gonna put in the communication piece. So instead of having the parents, again, bombarded with, hey, here's a 70 question survey from communication, here's another 50 survey from me. We're gonna put them all together and really just try to hone in on the communication piece that we gathered in the fall
right?
to see what's the response. Are we doing a good job with communication? What are some things that you might wanna add? Do you have some samples or examples that you'd like to see differently? So it's a more focused approach on surveying so that we know that, we already know that we don't need to shotgun effect everybody with questions. So let's focus in on some of the responses. We know we had too much communication coming from the district, so we fixed it. We're really looking at an elementary app for the communication survey, what we can narrow down for that.
Right.
So that's gonna be in February. So we originally, I think, thought maybe we'd have a mid-interval review with the Donovan Group in January. I think we're gonna be looking more February or March-ish.
Alright, so
So
do the
that'll give us
survey,
time for
yeah,
that survey,
Yep.
still for the
Yeah.
elementary staff too.
I like
Perfect.
that.
So I think that'll fit in good. I really like the idea of, we know we got safety plan coming up.
Yep.
And that might be closed full board. I'm not sure how, and that's one of the things I was gonna talk to David about too.
we did it that way last year.
And that's, I think,
And then I think we had the police chief and we had other key participants within it, just sit
Yeah.
down and talk about what's changes, what's happening. Obviously, there's been a huge investment made across the additional SRO between the cameras and how the facilities are operating and locked and all that jazz. So, yeah, we did it as a, and again, only reason it's closed is so that we are not broadcasting in detail what our safety plan is. But then in a position to feel comfortable that you guys are working through any weaknesses or cracks and stuff, so, yeah.
and I think the difference last year was I think David had the chief actually do with him the full site assessments. And I think he had him working through and gave his evaluation. Right now, we did all those in the summer, and that's one of the things you're gonna see in the safety plan too. So what I'm gonna be looking for them from is just a review of our plans. So I've got Chief Pulvermacher, Chief Waters, and David and I met with him and Lieutenant Brzezinski last week. But then also Sheriff Severson. So that's a little bit more of a, and I quote, they have the 30,000 foot view when we start getting the sheriff's department in, because that's a different response than a local, police department.
But in light of what happened today,
And I think that, I don't anticipate there's gonna be a lot of changes, but again, we want them to look at this. We want their eyes on it too, to see, because that's a different level of expertise for all of them. So that's gonna be something, once I get this finalized from the principals, after we get back from break, my intention is to send that out to all those different agencies. And then at the same time, that's gonna go out to the board, and then Nina signs off on it too, and then we are up to date. We are 2 years ahead right now, based
Okay.
on what we would normally do. So
Sure.
it's normally a 3-year process. Last January that I got approved, we're gonna be 2 years ahead.
Okay,
And again, that's gonna be in, we're not gonna wait 3 years to do this, just because of the importance of it, but how
for
much.
right now, the gravity of the amount of changes that you're doing, and then additionally,
it's true though, there's a lot for people to get up to speed on.
yes, and then to recognize it, and I'm assuming that's a submission on an annual basis.
Yep.
And then they just hold that you're doing refreshing on a minimum 3-year basis, so we're doing the changes on an annual basis as we're modernizing or getting our program up to
Yes,
speed.
and when you think about like even our maps.
Yep.
Chris Carlton and I were looking at our maps, and we've updated them 2019, and then he did an update 22, 23, but we're gonna do them again. And it's not because they're bad, it's just, that's how much things change so quickly in safety and security.
Does it,
And what
Well,
preferences
especially
are.
if you're putting more units, AEDs, I mean, that's all gonna have to be
Cameras.
located
Yep.
on the map
For
and
sure.
where to find what.
and is that actually part of an annual project? Because I would assume with the changes that are coming to the rec center and to Riverside,
It's a whole nother
It's a whole
level.
nother level.
like, you're like, this is like a perpetual, hey, maybe it's a quarterly, I don't know if that's too frequent of what's changing, maybe it's annually, but to the point of being able to just make sure that it is, cause I'm assuming that's part of a safety kit, that somebody who's gonna be administering that, hey, that's summer work to be able to make sure it's documented up to date.
So we've got 3 different companies that we've utilized for doing our maps. And the drawback is we used to get a map grant from the state of Wisconsin. That map grant went away, and now Chris is getting very creative with trying to find other vendors to use.
Okay.
So we do have one that he's pretty comfortable with, and right now what we've seen is a nice product. I mean, it's a very, very good product.
Okay,
We just gotta see how much financially that's gonna cost. And if they're willing to give us a couple here and there, which is what Chris had kind of worked in with them. It's not every level on our blueprint
Right.
quality, but it's our tornado and fire map style.
Right.
That they're able to do fairly quickly, that they're willing to show us, here's an example of what we can do.
Well, and again, depending on how much you own the change and say, we're doing the heavy lifting for you, we're mocking it up, and you just put it into the pretty design, then they're not having to come here and do the analysts to draw their own maps from scratch, you're getting them there to just make it pretty.
And honestly, it's other companies that have already created them before that we own, because the companies did it and we own them, so.
sure,
That's a great example right there, and that's another thing that we talked through today, because our principals and assistant principals are going through and creating those maps room by room. So they're not having to pay a consultant to give us our evacuation routes, because we don't need it.
Yep.
And it's just a matter of, okay, here's our shell.
Yep.
Now I go into any product, Microsoft, whatever, add an arrow, and here's this arrow, and that's a colored arrow for this, it's a colored arrow for that. So that's the work that we're looking at. So,
Awesome.
there is one other
A lot
thing
going on. Yeah.
that we talked about too from a training standpoint. And they've already done it before, most of the principals that I talked to today have already gone through this, at least through the 100 level. But it's through FEMA, the National Incident Management System. And as part of the state of Wisconsin Department of Justice process, every one of the administrators need to be at least ICS 100 trained. It's good practice because it's really, what is your role in a critical incident? And that's what the 100 level is. Most of us have gone through it to the thousands, 3,000 some of us. But from their bare minimum standpoint, the ICS 100 is really about, what do I do as a principal when the chief of police is now taking control of the situation?
sure,
And what's FEMA? FEMA comes in and takes over. So that's gonna be training that's gonna take place. places, some.
And you say they already know about it or they
Yeah,
have.
yeah, and some of them have already done it. We actually were joking around about what the requirement was from the timeframe, isn't it? And so Scott Walter's like, I think it was 3 years, and I'm like, was it 3 or 5? And kind of laughed. I think it might have been 10. Brad's like, really?
It's like I ran right out and did it already.
Oh, good, it's been here for 10 years.
Alright,
But
good,
that's-
yeah, there's a lot of good work going on and a lot of good work coming up, so thanks for staying on top of all that.
The one I would love to see is, added probably in the next quarter, no sense of urgency, is just a status on our IEPs. Take a look at, sort of a preliminary internal audit, just to make sure that we're in adherence, if there's outliers, how it looks and feels. I don't know how easy that is to pull together, cause I'm sure there's a volume. I just know that sometimes part of this is risk management and part of it is recognizing what you guys do on a day-to-day basis. But wanting to make sure we don't put ourselves in the same situation that we were before, and to the extent that we can get I'll say summary, I'd say executive summary, but I don't want it to be at the 50,000 foot level that we can't keep a pulse on, you know,
Building up or
staff
something?
and costs and expenses we're enduring, et cetera, so.
I don't think that would be, what we would call it is a mid-interval review.
Perfect.
Because if when Alec came in the first time and met, that would be like a preliminary presentation, so when it looks at the ultimate, like building goals. You know, if you got a building goal that you're gonna set around semester time, and generally when you start saying, okay, where am I headed towards this goal?
Yep.
You know, if I wanna have the decrease in number of Fs, what do I look at for my number of Fs that semester?
Yep.
So I think from Alec's standpoint, I don't think it would be a major deal.
Okay.
I can talk to him about it and then we can maybe put something on the calendar.
Well, part of it's
Yeah,
themes, like I
like
know,
that too, keeping a pulse on it.
And he's very, very thorough with that.
I need to be
So-
like, oh my gosh, they wanna see me.
Why are you looking at me?
You have an important job, come along. So he's done nice work, and I don't want it to be signifying that that there's not a trust, it's more a matter of, we wanna understand, hey, are the number of cases we have staying flat, are the number of cases we have increasing, are we staffed appropriately, are there
And
risk points?
that's a question I would have too, is
Question.
staffing,
Yeah,
right, because we
remember,
want
talked
obviously
about
that
at the beginning of
support.
the year, and that would be a good time to do it, because really, we're
Right,
looking
cause
at
you're just
staffing.
kicking off your staff, yeah, so,
Right.
No, I think that's more than, I think February, cause that'll give him time to compile his data
perfect,
for
I just
January.
figured sometime in the
Yeah.
first quarter.
Well, even when we met with the counselors, that's been a conversation we've had with them too.
Yep.
Because when you look at the 504 numbers that have gone up by the time that they hit the high school, it kinda comes back down to, it's like, what is a 504, what determines it? When you're looking at 9 or 10 at one level, and now we're getting a request for 50 evaluations at another level, we've gotta look at that.
Right.
Agreed.
So the counselors and I, that's one of the reasons why we've met in this, and the psychs and the social workers have talked through this, like, this is back to what is our education that we're doing. Because a 504 isn't, I'm gonna get an F on a quiz, a 504 is, I've got a qualification now for American Disabilities Act that by getting a 504, I'm qualified for special needs, and this is a pretty heavy document that people are just kinda like, it's just a 504, give me a 504,
Sure.
we can't just do that, it's kind of
Correct,
pricey.
you gotta be able to do the risk around it to be able to make sure that can we actually live up to the,
It's
again, like these are entering contracts and these are commitments to deliver service, and I wanna make sure either A, we're doing the quality check on the plans that are being offered, B, we're making sure that we're adhering to the details within the plans, and maybe rather than diving into individual plans, what's our process for quality assurance to make
Right.
sure that we're staying on track? So what do you do, what does, what's his name do to be able to just lead that program and feel confident, Alec, that it's working the way it should be, so.
And really, what, do we need it? If we can offer accommodations, meet the students' needs without a 504, or a federal document disqualifying you as a disability,
Right.
I think we could probably do it differently, and then we don't have to go through 5, 6, 7 meetings with you to do this.
Perfect.
If your kid needs a little extra time for a test, let's talk through that, what does it look like? And we're not gonna give it to them forever, but
Correct.
maybe for 1 or 2 here and there, the kid
Yeah.
feels a little more confident in what they're doing and studies differently.
That's awesome.
We don't need a 504, and that's one of the things that's come up a lot. And as you heard the nurses talk tonight about the 9 kids on their caseloads for 504s, the nurses are not case managers, they shouldn't be case managers for 504, period.
Correct, but
And-
if there's a medical component to what
They're
they're
a member.
doing, then they're
They
like
need
a
to
They're a member of the
co-op.
team.
Yes,
So this has been a very big conversation with our counselors, but also with our admin. When you look at who manages caseloads in 504s, predominantly you're gonna find that it's a shared responsibility. Generally, there'll be a counselor involved somewhere in the process,
Yep.
but it's almost always gonna be administrator managed. And generally, it's an associate principal. When I was managing 504s for our building, it was me, that was it. I had counselors, great counselors that helped me with that and definitely were part of that management process, but ultimately when responsibility had to tell a parent no, it did not fall on a counselor's shoulder who's meant to be building relationships in a different manner than administrators are. So that burden got shifted to the counselors, it sounds like, a couple years ago.
Okay,
And that's one of the drawbacks that they're having to get through right now, because again, they're trying to build these positive relationships with kids, and now they're having to tell the parents no.
well, and that would be another conversation to be able to say as part of this review, what are the opportunities on the horizon to be able to get at, so
So-
that we can look at how some of those, how we yield the best for the child and for the family and,
And still manage accountability.
yes.
And it's not putting it on someone who's not responsible for evaluations and observations.
Yep.
So it puts the counselors in a very bad spot that they really shouldn't be in. It puts the nurses in a very bad spot that they're not supposed to be.
right,
You know, they're providing medical services, not managing 504s. So that is a conversation they've heard, the counselors heard, but also the administrators heard. We're gonna be taking those back eventually.
well, and we
Right now
have
it's a partnership.
staffed the schools with APs too, to help
Alleviate
defer
some-
some of that burden, and so I think that it's time to review that again and, you know, a constant moving things to the most efficient way to get it done.
Yeah, and at the same time, we put it the way it's supposed to be,
Right.
obviously, and that's part of it.
And that just makes the APs more skilled. It closes the gaps on, hey, we're now cross-training in multiple roles as well, so that
Yeah.
people are fulfilling an easier job in the event there's a transition.
And then they can understand where it's coming from. So they're gonna be partners this year with the gradual transition, especially at the high school level, when we're looking at cutting down how many a caseload is per counselor.
Sure,
We're gonna be having that process eventually, and they're gonna go down.
Yep.
It's just a matter of people getting used to what we can offer outside of a 504 to help a kid out.
alright,
But then also for the administrators to be saying, okay, this is, okay, they're gonna be dealing with this anymore.
Sweet.
And the counselors, bless their heart, they said they didn't wanna do that, they didn't wanna bring it up, because they know how busy the administrators are, especially APs. But it's just, it's nice, I mean, it's, again, it goes to the compassion that our counselors have and our
Of course.
staff has.
But
But
to
it's
your
a matter
point,
of
it's true
listening.
ownership, and again, if you reduce the number of plans, rightfully so, like to be able to say we're meeting the needs of the student and the family differently, then it hopefully is a reduction in the time on the administrator as well.
Yep.
And then there's just skills offered by team members that are helping a student be successful anyway.
Yep, and then
That
the teachers
relationship
really
piece
doing
with the
what,
counselor,
they
yeah.
differentiate what they need to do for the students. So and overall, it's a matter of, again, systematically structuring what we do, then fundamentally it's gonna be better for everybody in the process. It's that front loading that's difficult. And the poor principal's having to sit through 6.5 hours with me straight on safety planning, and again, we're gonna get it done once, but then we're not having to do this every single year.
correct,
You're keeping updated, you're looking at stuff, you're gonna be more familiar with the process. Hopefully the state's not gonna change requirements or Department of Justice, but it's that heavy part in the beginning that makes it a little rough.
sure.
Alright, awesome,
Anything else for future agenda items?
I'm good,
Okay, alright, I need a motion to adjourn.
I will motion.
I will second, all those in favor?
I
Aye. Motion has passed, meeting is adjourned at 7:53 PM. And I should know this off